My name is Shetima Carr-Stevens. I am currently the administrator for both Vital HomeCare, located in Asheville, North Carolina, as well as Broadway Home Care, which is located in Raleigh, North Carolina. How I started in home care primarily was when my grandmother became sick. I found that I ended up having to do a bit of research. While doing some research, I found a company that was looking for someone in an intake. I found it intriguing, didn't know much about it. While I found that entry level position, I found like a lot of deficits. I had tons of questions for my grandmother as a family member. Who would I call? What's home care even about? Who are these people that are going to be coming into my home? And where do they get them from? Why would I want someone in my home? My grandmother was very, very afraid at the time, having a stranger, as she would put it, coming into the house. I found with that position my passion for people. And I didn't just want to be at a desk, like shoveling papers. I would find a reason every day to call someone. I found so many ways to help that particular company with quality care and quality assurance by making contact with our patients at that time. And my passion for home care grew exponentially from a customer service perspective. And I just kept learning and wanting to learn more about the business, and I just kept growing in home care, or what I love to call the business of people. So I have several patients throughout my career that I have made lifelong relationships with. Patients that literally call my daughter their granddaughter, and we made lifelong relationships where I consider their family my extended family. So, in this course of business, in order for you to connect on that level with any patient, you have to be able to find something in common. And my common way of connecting with them is family. To speak to someone considering a career in home care, I would love, or I do tell people, don't consider it just a home care. Consider how would you want someone to take care of your mom, your dad, your sister, your brother, your children in the event that you're unable to do so? Family gets burned out. It's very hard to care for our own families, especially when they're very, very ill. It's very sensitive for us. It's hurtful, it's painful. And sometimes we just have to reach out and ask for more help. For me to reach out and tell someone to jump into this field, you have to really have passion, a love for people, and I really would extend the opportunity for them to look past the job, look past the business, look past the career field, and think of everyone as someone of coming from your cloth, or someone coming from within your home, and how you would want them to be cared for. In order for us to keep our geriatric population, our underserved population at home and healthy in the homes that they have their fondest memories, the homes that they've sent their children to school, the homes that they cook dinner, have family gatherings, spent holidays, we need to make sure that we are working together unanimously and moving forward with making sure that there's adequate funding so that people like myself are able to employ and continue to employ um, individuals to go out into this field and provide adequate care. Now, in order for us to also do that, we as a network of people have to also speak out, right? And also have to make our voices heard and band together and be one sound accord and yell at the mountaintops that we need their help. In order for us to do that, we definitely need to, the legislature needs to know that home care is pivotal. We don't want to put our family members in facilities. We don't want to see them out of the home. We want them at home. I want to see the younger generation understand what in home care is. I would love to see more young people get into this business. I feel like the younger you are, the more energized you are. You have such longevity in this business. There's so much room for growth here. Not just in home care, housekeeping. Having companion care, pet therapy, music therapy. So many levels of home care, and we have to start thinking outside the box. So for me, I do it honestly because I am relatively young in this business as far as age wise. So when I go into meetings and walk into a space, I love to encourage others. Like, listen, tell your nieces, tell your daughters, like, bring them along. Like, this is something amazing for them to be a part of.